Good morning, everyone. I'm a little tall, so I'm going to move up these mics. And then because I'm a community person and I'm a community advocate, and it's always community first for me, I'm going to say good morning again, and I'm going to ask the community, which everyone is a part of, to say a good morning that sounds like community's in the room. So good morning, everyone.
Good morning.
Good morning, everyone.
Good morning.
It's really important when we talk about community engagement is how we approach the engagement with our community. And it's really important for us at Diaspora Community Services. One of the things we asked ourselves recently in a strategic planning meeting was, what makes us different? And so for us, one of the things that we were clear on, and all of our staff was clear on, was we not only had staff that reflected the community, we heard the commissioner talk about that, we heard the school talk about how they're proud of themselves, and they should be, at the amount of African American professionals they're putting into the medical field. But we also pride ourselves, as well as the Arthur Ashe Institute should, that our leadership also reflects. It is really important that decision makers about policy that affects health disparities and affects people of color reflect them as well. So I want to challenge us for the next conference, because I'm sure that we'll have one, is that we fill the room with a little bit more people directly from the streets. It is great that we have people from community-based organizations here, that academia is here, but we need to have the actual people who this is affecting differently here, because their voice is missing, as well as the fact that they're not listening to what we're saying. They're not here, and that's important. And I was actually sitting there saying to myself, that's our charge as well as community-based organizations, is that when we know we're gonna participate in things like that, that we bring our participants with us. Because one of the challenges that we have is we learn a lot. We're one of the organizations that purchased SPSS after coming to the training, because all my staff came back excited. And so those are the types of benefits that we talk about being a part of a collaboration. A real collaboration is win-win. We're here and they're here for us. We're able to get what we need to then have our staff be trained appropriately to work appropriately with the community. But I'd like us to go a step further. So for us, one of the other things that we learned was how to do surveys appropriately and do community needs assessments, of which we're doing another one. So the data that we actually collect in SPSS will be a reflection of what the community believes are the real issues. Because a lot of the times we talk about social determinants of health and we talk about what we believe the social determinants are, but the question really is, what does the community believe the issues are? Because we come in and we say we're gonna address all these issues with the things that we believe they understand. But if they don't believe it's the issue, we hit these walls. And I think that's what we see a lot of the times in the data, is that we're trying to address things without their involvement. And so when we talk about community engagement and collaborations, again, I want to say it's really important that it's win-win. So I love the collaboration that we have with the Arthur Ashe Institute and the Brooklyn Health Disparities Center, because it does bring academia together with research. There's a long history in the communities of color, especially the Black community, where there's some distrust in regards to research. We know all about the Tuskegee, we talk about this so much, we talked about it in some of the trainings. Community-based organizations have a different level of accountability to community folk. And I'm gonna use this water. I don't know if it was mine. Because initially I thought we were sitting and I was like, oh my God. Marilyn did mention I'll be standing. I'm 6'1", I don't particularly always want to stand up. Where was I? You know, when I get going, I lose myself. Accountability. Thank you, Ruth. We have a different level of accountability as community-based organizations to the community. And so it's really important when we talk about trust and trust in research that we are a part of the conversation of trying to engage our communities in participating in research. One of the things that I recognize when we're looking for evidence-based curriculums and programming for our youth is that young people of color, particularly in New York, are not a part of any of those evidence-based curriculums. Research is not conducted with our people in particular in this state. And so it becomes very difficult when you're trying to do programming that you think will be effective to find things that was researched amongst our people in this state. And because of that reason, it's really important that we be engaged in the conversation of how do we get our communities not only to just trust us in research, but to demand that research be done in their communities. Because one of the issues as well is that they're quiet about the fact that while nobody looks at them behind these walls, that no one's gonna look if you don't say anything. And they will continue to die at rates different than everyone else. And I want to applaud us for having the conversation where we're actually talking about health disparities and saying the actual scary word of race and discrimination and talking about structural racism that is what propels a lot of these things. And when we talk about past, present, and future, I think it's really important to know that in the past, there was all of these issues. We knew that there were trust issues. We have code word and code switched and start saying that we live in a colorblind society. And now in the present, we don't talk about race when we talk about things that are affecting people at different levels. And so I want to applaud the Institute for being courageous enough to put it in the room. Earlier this week, I was at a very great conference about homelessness in children. And it was daunting, of course. The statistics were horrible to watch how many young people were living inside the shelter system in New York. And no one of all these great minds in regards to homelessness, which we know is a part of a public health issue, was courageous enough to talk about the disparities of the young children that are in the shelter system. Not one person. On this panel of individuals who were talking about the real face of homelessness, no one was prepared to say the percentages of Black and brown children that were in the shelters. So it's important that we continue to have these conferences. It's important that collaborations exist. We've benefited so much from this, and so we want to thank you publicly and in front of everyone. One of our great stars at Diaspora is currently an intern for the Arthur Ashe Institute. And so it's how we feed each other, how we give back and continue to give back throughout the experience. So I just want to thank you guys for having us again and again, and we'll always be here, because that's what community does. Thank you.